So like I said, it's a 12-part module, and it's broken up in this way so that it's easier to track, it's easier to follow, it's easier to assess. The assessment will be at the end of every month. So if you do module 1 to 4, the first month, we take the assessment for that. Module 5 to 8, we take the assessment for that. Module 1 is like an introductory module. There you will be taught how to understand what your roles are and the scope of your practice. How far can you go? What are the things that will be expected of you? If someone offers you an employment now as a healthcare assistant, what are the responsibilities that will be expected of you? Then all professions are guided by a set of code and conduct. So we'll discuss professionalism, ethics, legal responsibilities in healthcare. Every person who is certified as a healthcare practitioner, even though your portfolio may not carry a licensing in your country of residence, such an individual can still have legal cases where you need now say someone was sued for malpractices or negligence and the like. So you want to understand broadly what are the possibilities that could happen. So that is still under module 1. Then it would also now reinforce the fact that the healthcare assistant is not working alone. Generally, medical and healthcare is a multidisciplinary game. Somebody is always passing the baton to the next person. So for any patient you care for, whether it's in the hospital or is in someone's home or is in hospice care, wherever it may be, you would have a number of people you're working with nurses, working with doctors, working with lab persons, even the family members sometimes could also be multidisciplinary team. So that is another thing we'll cover. Then the final one is that it's healthcare should be patient-centered. Patient-centered means that your care would be you aiming to demonstrate compassion, respect, dignity, and then cultural sensitivity. That is a very important thing, because I usually tell, there was a batch we had sometimes last year, and we would always reinforce that in case you go out, some of the things that are obtainable and permitted in Nigeria, you will not want to do that if your patient is a Canadian or your patient is an American. So those cultural sensitivity is also important. We have that covered, and that will be attended to in module 1. So module 2 is infection control. So the principles of infection control, chain of infection, how can infection spread from one person to another and to another? Then the hand hygiene, that again will be reinforced. I know during COVID, many of us had hand hygiene, but now within this program is something that we would really need to discuss about at length. Then PPE, that's personal protective equipment, use of glove, use of face mask. In situations that would require you to use an apron, use of apron, that would also be taken care of. Then environmental cleaning and disinfection, that's important. If you have a 90-year-old that is a patient that you're caring for, the environment has to be taken care of if the patient will not be a victim of avoidable infections and avoidable injuries. Then how to manage waste, how to manage sharps. Sharps are blades, needles, razors. It's unlikely you could use a needle in your patient's home, or even with your patient, if you care for the patient in the hospital. Glucose test, many times you will need to prick the person with a needle. Good disposal of that is an absolute necessity. Then healthcare associated infections, those ones are in another class by themselves. Healthcare associated infections, we would also call them nosocomial infections. They're infections that at all costs you want to prevent them, not acquire them. Then procedures for isolation, then your role in a safe healthcare environment. We would attend to this in module 2. Then module 3, communication, documentation, and customer care. Your patients are also your customer, and they will say patient is always right. So ability to interact and build trust and positive patient experience, that one is is an absolute for anybody who is a healthcare practitioner, and especially for someone who is an healthcare assistant. Then communication, because you are working in very close proximity and you're offering service, and you're offering a service that has to do with life. Your ability to communicate is important. And you will now come to realize that communication is both verbal and non-verbal. If someone tells you sorry, in fact, for Africans, non-verbal communication is a real deal. Someone could tell you sorry, but without saying much, you know that sorry is not a heartfelt sorry. What allowed you to know that difference is the non-verbal communication. The verbal communication, you heard sorry, but there was a vibe that came off that let you know that this is not really sorry. So you want to understand that, and from there pay attention to your own non-verbal communication as you care for your patient. Then documentation is an absolute. It's said in the healthcare system that if you don't write it down, you cannot say you did it. And if you ever work in climates, in environments, maybe America, US, where people are really, really witch hunting documentations, that's one field that you don't even want to take chances with. But even in Nigeria, if we come back home now, patients are more aware of their rights than with the younger generation, with the advances in internet, with the fact that you can search anything up in a jiffy. You want to be sure that your work is accurate, is clear, and is timely done. If you do a procedure by 2 a.m., you cannot just be remembering to write it by 12 in the next afternoon. By then, you won't even remember the details. How would you write all the other procedures you did between 3 a.m. and 12 noon? So as it is done, you want to record it immediately. As soon as you've washed your hand and there's nothing urgent that needs your attention, then handing over technique, because I said it's a batting game. If you can remember races where they used to pass baton, you pass it to the next person, pass it to the next person, pass it to the next person. So you want to understand how handing over is done, is structured, is safe, and is effective. Then observation and reporting, and so on and so forth. Now, by module 4, now we are beginning the hands-on. At this point, you're doing activities, procedures on, with, and for your patient. What will be expected of you to be able to monitor temperature, but you'll be in the hospital anyway, so you get that quite a lot. Temperature, pulse rate, blood pressure, respiratory rate, arterial saturation of oxygen. Then you should be able to carry out basic pain assessment. You have a 72-year-old who is in the hospital, maybe admitted for pneumonia, and you're the caregiver or the nursing assistant with that patient. You should be able to objectively assess pain and be able to feedback to the next person on the protocol that so and so patient has a pain scale of 4 or of 7. Still in this module now, your ability to recognize if your patient is getting worse, fever, difficulty in breathing, respiratory distress, shock, if there's an infection, if the patient's consciousness is beginning to get altered, then if your patient is not making enough urine, and the time you need to escalate will then mean that you're raising an alarm or something is going on with my patient. But you must be able to recognize to be able to escalate. So that will be taken care of in module 4. Now, so far, I would appreciate if I can get a feedback to know if you have questions. So far, are you with me? Do we have questions? Is it clear so far?
Yes, ma. I don't have any question,
ma. Very clear, ma.
Okay, thank you very much. Thank you. So module 5 here, we come to personal hygiene, because part of the responsibility of healthcare assistants is also personal hygiene of their patients. You could have patients who are bedridden that will need bed bathing. You could have patients who would even need oral hygiene, maybe patients who cannot do this for themselves. Some of the patients you care for are stroke patients, patients who have had surgeries. Maybe someone had a bone surgery, and obviously they need care. Bone surgery cannot go to the toilet themselves. They will need care with some of these basic activities. So module 5 is personal hygiene, care of bedridden patients, then prevention of pressure ulcers or bed ulcer. Pressure ulcers are just wounds that will arise because a patient has been lying on a particular part of the body for a long time. You know, all of us, when we lie down, naturally you want to turn to the right, to the left. But for bedridden patients and patients who are deeply unconscious, many times they don't turn. If they don't turn, they could develop ulcers at the pressure areas, the elbows, the shoulders, the bum, the heel. The heel is the back of the foot. Any of those places could have pressure ulcer. So under pressure ulcer prevention, you need to know that is an entity. That's something that could happen. Then you want to be able to assess your patient for the risk of it developing. You should be able to assess the patient's skin, turning schedules. At HES, for instance, usually we'll do a 2-hourly turning for any patient who is bedridden, who is unconscious, who has had a stroke. A stroke may be conscious but is not able to turn. So you also need to do 2-hourly turning for them. Then skincare is also still part of that. Then nutrition, and then in case the patient even now develops pressure ulcer, how do you care for such wound? And then there are some pressure relieving devices that you will learn about also in this module. So now, still on assisting those who cannot help themselves, the activities of daily living are the same thing we do for ourselves. You will bathe, you will dress, you will groom. Groom is we comb our hair, we rub cream, we wear clothes, those kind of things. We do oral care, we brush our teeth. People will go to toilet to pee or to poo, and people will eat. Those are activities of daily living. For some people, they will need assistance with this. It may not even be someone who is very old, because part of the module, part of the program is also newborn care. A newborn will need assistance with activities of daily living. They can't bathe themselves, they can't feed themselves. Anybody who is 1.5 and below, that's 18 months. If you are employed as a healthcare assistant to such a child, you know you're doing literally all of that for such a child. So care of the bedridden patient is also to maintain comfort and dignity, be sure the linen and the bed is well taken care of. So bed making is one of such. Then promoting rest and sleep, and then emotional support for such a patient. Then here we would also take care of how you turn and reposition patients, how you move patients, how moving patient with body alignment. Because if you have like maybe let's say 70-year-old patient who is a bit on the big side, who is weighing like 70 kg, and you are weighing 60 kg, there's a technique with which you will move such a patient. If you are the only patient, the only caregiver, or the only healthcare assistant with such a patient, there's a technique. So we'll discuss this, then use of pillows and support devices, and a number of other wonderful, wonderful things in Module 5. So Module 6 is nutrition, hydration, and feeding assistance. Here it means you even need to understand basic nutrition, because some diabetic patients, they will tell you they can't eat this, they can't eat that. Hypertensive patients don't really have a lot of restrictions, except for reduced salts and reduced oil intake. But you need a solid understanding of basic nutrition, which we'll cover here. Then you need to also understand, what does a basic balanced diet, what does it entail? That would be like a revision, because everybody who did basic sciences would understand that. So special diet in situations where, where your patient is placed on this diet and they say remove this, remove that, this module takes care of that. Then hydration, you have an elderly person who doesn't want to drink. What are some other ways you make this patient hydrated? Is the patient going to be drinking pap? Is the person going to drink soups? Is the person going to drink tea? But it also means that you will know that hydration is an absolute necessity. My elderly patient, and at all costs, I make the patient drink, especially an elderly person. Maybe the person has Alzheimer's disease, has dementia, where they're forgetting things, and they are almost getting regressed, and they're not as they used to be, and they see water as something that they cannot drink. You need to be able to employ some ingenuity around such a challenge, and then you need to be able to recognize that this patient is getting dehydrated. So what are the signs and symptoms of dehydration? We'll take it then. Then you also want to be able to monitor fluid intake, because sometimes they will say monitor the patient's input and output. So how much did this person drink and how much did they pee? You should be able to measure it and then be able to do the subtraction. That's the fluid balance monitoring. And in some situations, you may need to assist with feeding. The way you would assist a 10-year-old who is conscious, who is alert, who is willing to eat, is different from the way you assist a 79-year-old who is semi-conscious, or who is very senile and very weak. The techniques are completely different. So then you want to feed them upright, you're giving small bites, you're going very slow, because picture that 79-year, maybe there's no tooth left in the mouth. So you know that person will go very slow. But picture a 10-year-old, as soon as you put it, they chew it, they swallow it, except the 10-year-old is ill. Okay, and then you also want to understand aspiration prevention. Aspiration is like choking. That means the person swallows, but it does not enter the throat. It does not enter the esophagus, but enters the airway. Could be a cause of pneumonia in elderly people. So maybe you have a patient who is bedbound, bedridden. You want to be aware of that and be able to prevent it. Okay, then oral care still before and after meal is an important thing. So monitoring intake and output. I think I've mentioned that how much did the patient consume, you should be able to track it. That's documentation. In fact, some places they will tell you to even weigh how many grams of so and so did the patient take, how many meals of so and so did the patient take. But you need to know that this is an intentional thing. It's not just that someone is making you write numbers. All right, so that will be taken care of in module 6. So module 7 is mobility, rehabilitation, and patient safety. How do you move your patient safely from one place to the other? You would also understand body mechanics, because if you are weighing 60 kg and you have to move a 70 kg individual, you need to understand body mechanics. If not, you will snap something in your spine. This module takes care of that. Then you also want to be able to assess risk before moving a patient. Keeping in mind, it's not only elderly people you care for. You could care for someone who has had a stroke, or someone who has had a fracture. You want to understand the risk associated with moving such patients. Then there are equipment that will make moving your patient, transferring your patient very easily. So you would understand such equipment and how to use them. So mobility from bed to chair, from chair to bed, from wheelchair to the toilet seat. That's another thing. From toilet seat to the wheelchair, that's another thing. Then for those who are able to walk with the use of walking aids, there are several walking aids. Like the man in this picture now has a Siemens frame. It's a walking aid that looks like a table. That's one. There are walking aids that look like the normal walking stick that you know, and a number of other types, such that you may even be caring for an elderly person and you realize, this patient will need Siemens frame. It's on you, the professional, to then recommend to the relations. Instead of everybody holding Baba or Mama on both sides, why not get a Siemens frame? Or this patient had a stroke and now he's becoming mobile a bit. Can we increase the mobility with Siemens frame? Because they would literally hold that thing that looks like a table that you're seeing in the image and then be able to take baby steps with it. Then rehabilitation and support, especially for those who have lost functions and they now need to regain it. So that would be someone who had a stroke, someone who had a fracture, someone who had significant injury, maybe they sprained ankles and they need to now start learning how to use those body parts again. That is another thing that will be taken care of in module 7. So module 8 involves care of older adults. That's frank geriatrics care. Module 9 is care of newborn, because those two extremes many times would need healthcare assistance, many times. So here we would be discussing in details the aging process, physiologically, psychologically, social changes that happens with aging. Then how do we promote dignity? Because in spite of the person aging and still wanting to promote their respect, knowing that old age is a place that we're all coming to, nobody plans to die young. Because a challenge is for health care assistants who are not well taught, who see the profession as an opportunity to just do a job, because it's more than what you do. It must become who you are after a while. If any of this age range will be more abused, many times it's the very old and the very young. So you would have people who would leave the woman unfed, who would leave the woman unbaited, who would even beat the man because the man is a bit senile. So those are things that we want to understand, that they are complete no-no, they are not even ethical. Then also understanding individual needs and preferences. Then here we will be discussing common geriatric conditions, arthritis, hypertension. Arthritis many times will limit mobility. So that's one thing you want to keep in mind for your patient who has arthritis. Hypertension, we must track the BP daily. And then we must make sure the patient is regular on their medications. Then diabetes mellitus puts you in that position where you are stewarding their diet, because it's not everything that is permissible for a diabetic patient. Then maybe person had a stroke or dementia or has visual or hearing impairment. Okay, we need to change the battery for the hearing aid. We have to have it plugged. Otherwise, your patient will not be able to hear anything the next morning. All right. So then dementia care is a field we would also address, because dementia simply will be loss of cognition. Loss of cognition is your ability to know, to hear, to understand, to comprehend, to interact. That's the simplest way I can explain that. So for patients who are demented, they begin to lose this as they age. They are a special class, if I can use that word. So you want to understand how you'll be able to care for such a patient. In fact, there's extra certification in some places. It's like specialization. Yeah, that's the word. Where you now say you have certification in dementia care, in Alzheimer's care. That's another class entirely. So dementia care would allow you understand behavioral changes that happen in people who have dementia, the ways you will communicate with them, because somebody who cannot comprehend, the communication is not the same like I am having with you. Then how you create a safe environment for them, because some of them could just wander off and then you're looking for them. And then this dementia care requires an extra level of patience and reassurance. Patience on your own parts, because it could stretch even the toughest of persons. Reassurance, just trying to let the person calm down again, that they're in safe hands. Then as much as we want to care for the elderly people too, you also want to promote independence. Whatever it is they can do for themselves, you want to encourage it. Your aim is to support, not to take over the individual's care, whereby the person is not even doing anything again. You want to still encourage them to do as much of what they can do themselves, because that prolongs longevity. So daily activities that I was talking about, if Baba can bathe himself, let him bathe himself. If all he needs help with is buttoning the shirt because his hands are shaking, limit it to that. It's not mandatory that you want to stretch it beyond that. All right, then in situations where people would be said to be in hospice, hospice is end of life. Those are another set of people that may be needing the care of healthcare assistance. Maybe someone who has a stage 4 cancer that is not curable, or has a condition that is progressive and there's no cure for it. So usually such people will be committed to end of life care or hospice care. The aim in end of life is give comfort and symptom relief. So those people, they are going. Medically, we don't know when, but medically it's been said that there's nothing that can be done for so and so person. So the role of the healthcare assistant in such situation is comfort and relief from pain, from distress, emotional and spiritual support, regardless of the person's creed. Even if the person is a Muslim and you are a Christian, and the person needs spiritual support will then be whatever the person wants you to do. If the person says, read the Quran for me in English, in a language you understand, you do it. And if it's flipped the other way, if you're a Muslim and your patient is a Christian and says, help me read it, it's spiritual support. The person is not converting you. This person is going. Whatever it is you can do to make life easier for them, those will be the responsibilities of the healthcare assistants. Then at that point, you also want to respect their choices and their values. And then whatever happens, regardless of the state, you still make sure that they are being treated with dignity, even if the person will go in the next moment. So newborn care is also, let me just check in, please. I want to be sure that I've not lost you. Please, any feedback? How is it going? Is there anything you want to ask, clarify?
I think the network is not good from that module 6 to 7. I wasn't able to hear you then because I don't know what happened to my network then.
No problem. It's being recorded, so you'll be able to watch it tonight. It will be on the platform tonight.
All right, ma.
So I can progress then.
Yes, ma.
Okay, thank you. So
You're welcome.
newborn care would require understanding who a newborn is. What are the special characteristics of newborn? What is a normal vital sign for newborn? Newborn vital sign is very different from adult vital signs. A newborn could have a pulse rate as high as 150, 160. If you have an adult with a pulse rate of 160, that is some serious medical condition going on there. So you want to know what the normal is, so that if there's a deviation from the normal, you'll be able to take appropriate steps. Then what are the immediate needs of the newborn? Then what are signs of danger? At what point do you go looking for a senior medic for this newborn of yours that you've been requested to take care of? So immediate newborn care is you want to dry and warm such a baby. So that also means then that a healthcare assistant can work in an obstetric clinic where their responsibility is they just take care of the newborn babies. As they come out, they are on you. You're feeding them, you dressing them, you are doing all of the hygiene and comfort necessarily. If it's not a sick newborn, wonderfully you can do a good job of care for such a baby. Then the airway, if there's a need, it will be cleaned. Then cord clamping and the likes. Then the goal is always exclusive breastfeeding. So your baby newborn that comes out, you want to initiate breastfeeding and a number of other things. Now it bears saying that newborns are from 0 to day 28. So any child less than 4 weeks is said to be a newborn. By the time they are more than 4 weeks, we call them babies. We call them infants. So some danger signs that we'll discuss at length is maybe the newborn has difficulty in breathing, is not feeding properly, has a fever or low temperature, has yellowness of the eyes, which is called jaundice, or the baby is weak and has an unusual cry. Those are things that, as an healthcare assistant, you must be able to identify and escalate appropriately. Then medications is another field and another responsibility that will be expected of a healthcare assistant to be able to carry out comfortably. Oral medication, especially. So I said oral medications, especially. There's nothing complex about oral medications. You will know that this medication is dosed at so number at so times. Then in situations where your patient is on insulin, any patient that is on insulin, if they can self-administer, a healthcare assistant should be able to administer it to such a patient. Because many times we'll teach a patient on insulin on how to administer their insulin. There are situations where we'll send a patient home. So if such a patient has a healthcare assistant, it's on the healthcare assistant to take care of such. There are even situations where someone will have a stroke and then we feed via some other routes, via the NG tube. That's a tube that goes through the nose into the stomach. In such situation, it's not a big deal. The healthcare assistant should be able to, but that would mean that the person understands medication safety principles, the rights of medication administration, which is, we call it 5 rights. You want to be sure it's the right patient, so you don't give the wrong drug to the wrong patient. This could happen in elderly homes where you have like 20 elderly patients and they're all on drugs. So the healthcare assistant in such a facility must be able to correspond. Are you Mr. John? Are you Mr. Jones? So that we don't mix your drugs together. So then the right medication, which of these are we taking in the morning? Which of these are we taking in the evening? A way to manage this well, as you will come to learn, is documentation. So for every patient, there is documentation. So even the healthcare assistant has documentation for their patient. For patient so and so and so, I do assisted activities of daily living with the person. That's bathing, brushing, and dressing. Then we give medications. Then we feed. Then we exercise, and a number of other things. At so and so hour, these are the things we do, and we track the urine output. So a medical assistant will have such documentation. So the right dose, the right route, if it goes by the mouth, it has to be by the mouth. It can't be another route. Then the right time. If we're supposed to give it morning and night, you can't give it in the afternoon. That would be a wrong time. then the right reason. So that is sometimes added. Why are we giving the man the medication? Is a known hypertensive who has been placed on this medication. So then you also want to understand how to prevent medication errors. That will mean you're reading labels carefully, especially labels that has been written from the hospital. If your patient is on 1 3 times a day, written as 1-1-1, you have to read it well to be able to comprehend. Because sometimes I have elderly patients that clearly you can see the carton. It is 1 that is written on it. And the patient will tell you, I've been taking 2. You know, that's an error. It can come by virtue of age and the fact that cognition is declining. You know what I told you about cognition, ability to understand is declining. So that could cause that. Then you want to double check your patient's orders. Orders is just the way the dose has been said that you will use it. Check it again and again. If you're not even sure, call up the person that prescribed it. I just want to confirm. Did you mean 2 in the morning, 2 at night? I want to clarify. Then when you're given medications, you cannot afford to be distracted, especially if you have an elderly patient who has plenty of drugs. You could pull out all of the drugs and find that you have removed from the wrong blister, or you have removed 2, and then a number of things could happen, especially if you do that with blood pressure medications, antihypertensives. You could find that the patient's blood pressure is crashing and a number of other things. If you do it with anti-diabetic drugs too, you could find that the person's blood sugar is crashing. So you cannot afford to be distracted when you're administering medications. And when you're unsure, you would ask. Any medical person, you must always ask. We call it 2-factor authentication. If you want to do 3-factor, 10-factor, is better, because this is human lives, not some other kind of endeavors. Then you want to understand common groups of medications, what are antihypertensives, what are antidiabetics, just basically, so that if you're employed and your patient is on nifedipine, you will not be wondering what is nifedipine. You know, that is a class of antihypertensive. That's all. You don't need to know how it works. You just know that nifedipine is an antihypertensive. Then they use the side effects and then give us prescribed. Okay, so that covers for module 10. So module 11 is basic wound care, catheter care, and specimen collection. Why this is important? The word is basic wound care because there's advanced wound care. If I have maybe a 14-year-old who was injured on the field and has a scrape and lives very far, and there's a healthcare assistant on their street who is certified and skilled, why not do the dressing? That's one. 2 is also that you have an elderly patient who has bed ulcers. That's the pressure ulcer. The bum is bruised because they've been on the bed all day. I don't need them to bring such a patient to the hospital every day when they have a healthcare assistant that can take care of it. So in elderly home, in hospice care settings, in hospitals where where healthcare assistants are employed, for those basic cares, usually is delegated to healthcare assistants. So then catheter care too is also you being able to care for the catheter, just do what it is, clean around it, empty the catheter. If there's a need for change, you communicate with the appropriate personnel to change it. So that would also be covered. Then specimen collection, if your patient is told to produce pee, to produce poop, to produce sputum for tests. Sputum for test is a common test we do here for pulmonary tuberculosis or for chronic cough, as the case may be. Ability to produce, you know that it's sputum we are producing, we're not producing saliva. So wound care fundamentals, you want to understand types of wounds, the stages of wound healing, infection control in wound care, basic wound dressing, and then documentation. So I did Mr. So-and-so dressing at 2 p.m. How would you describe the wound? It looked clean, it looked dry, or it looked oozy and foul smelling with greenish discharge, as the case may be. You write it. Then infection control again is something you can't let go, usually in wound care and catheter care. If not, you make the person worse than they were before. So hand hygiene, use of PPE. This lady is wearing a glove. That's a personal protective equipment. Then you want to maintain asepsis. Sepsis is infection. Asepsis is no infection. So whatever it is you are doing, you are trying to maintain no infection, no contaminator, no contamination. Then for catheter care, we'll talk about catheter, then how do they care for catheter, and so on and so forth. Then we'll also talk about how to prevent catheter-associated infections, specimen collection for urine samples, for stool sample, for sputum samples, as the case may be, then handling of specimens in case you have to collect it from another facility and carry it to the lab somewhere. Labeling is important because if you don't label, by the time the samples get to the lab, samples do not talk, so you don't know who has which. And then we have switched the sample of Mr. John for Mr. James. You don't want to have such errors or such mistakes. So the final module is emergency response, mental health awareness, professional development. So being able to recognize emergencies and then respond to them. So you have choking is a common emergency that will happen with either the babies, the newborns, or the elderly you're caring for. Anybody that will need assistance, they are at risk of choking. Seizures, if somebody is convulsing beside you, what should you do? That is taking care of them. If someone has stroke, is having a stroke right there and then, right in front of you, your ability to recognize and know what to do is also another thing we would take care of. Then heart attack recognition, we've seen it in movies. Person say, my chest, and then you just find that the person is going down. The patient is a non-hypertensive already, and then it's your patient. You should be able to describe and then be able to respond, recognize and respond. Then hypoglycemia, maybe your patient is a diabetic patient and does not wake up the next morning. You should be able to say, okay, is it glucose level? And then be able to do the person's glucose check quickly. Then in cases where patient loses consciousness and stops breathing, basic life support, ability to do CPR. CPR is cardiopulmonary resuscitation. You will see this at the hospital. So ability to do this is a basic skill that everybody must know. In fact, I understand that in the US now, they're even teaching children in secondary school such that if a colleague of theirs collapses and is not breathing, they know what to do. They are not clueless of what to do. Then supporting vulnerable patients, we'll talk about that. Mental health awareness. This is a necessity both for the caregiver and the patient, even for all medics, because there's that entity called caregiver burnout. You can call it medical burnout. It's a field that demands both blood and sweat. So you want to really be able to take care of yourself, and then from that place of having taken care of yourself, be able to take care of other people. You can't pour from an empty cup. So we'd also have depression and anxiety awareness. What are the early signs and symptoms of mental health disorders? How do we begin to reduce stigma around mental health? Then we'll talk about workplace professionalism, punctuality and reliability. Those are non-negotiables for any responsible medic. Then dress code and personal hygiene. Ideally, one should dress smart coming to work. But thankfully, with the scrub age now, everybody can wear scrub and look good. And then it's budget friendly. You don't need a full wardrobe to be able to look smart. Get three pairs of scrubs and then you change it and you are good to go, looking professional. Then we'll still reinforce ethics and confidentiality, then accountability and integrity, then teamwork. Teamwork, because every medical field is a baton game, is a team game, it's not a solo game. So, and if you will work effectively in any team, you must be able to communicate, respect people's roles and responsibility. Conflict resolution has to be on point, and then being able to build a positive culture. Then going forward, what are ways that you can continue to build your career and profession? Then interview preparation. If you're going for an interview to seek for a job, how do you prepare? Then what career opportunities are out there for you? Then continuous professional development. Can you then begin to consider specialization? I mentioned dementia specialization, Alzheimer's specialization, newborn care specialization. So such that you don't have a basic certificate, you now have more. So this covers essentially the entirety of the module. So I will take questions now, and I will stop recording now too, so that I'll be able to demonstrate how to navigate the online platform.
Yes, ma, I can hear you, ma.
Okay, so you can see module 1, module 2, and so on and so forth. Now, the way the course is that if you have not finished module 1, you cannot access module 2. Module 2 is locked until you are done with module 1. So if I click module 1 now, so I have a number of videos to watch, but every introductory video has, the first introduction has a number of write-ups that is important to read so that it further reinforces what you are doing in the program, and has a link. Now, this is a link that has also been incorporated. All of this playlist has been included in each of the modules. But why it is combined here is when we ran this program last year, we also ran it as, I think, a 15 module program. All the recordings are hosted on YouTube. So the link is just combined here. It is opening in another page. I want to believe you can see it. Can you see loading PDF, please?
Yes, ma.
This is the link. Supposing you open it, you click on it, copy it, and then it takes you, you can copy it and post it on YouTube. But even if you don't want to go through that stress, all of that link has already been incorporated into the entirety of the module. That's the first thing I want you to know. So now, week 1 note is important. That's like the note, or the PDF, if I can call it that, the note you're supposed to study for the week 1. It's important that you go through that. You know, because I say it's 90% online. I'm not coming back to explain this. You just know, okay, what are my expectations for week 1? These are the things that are expected of me. Is opening. But why I leave it to open? Now, supposing I'm done watching video for the first module, for this introduction, I come here and I click it. When I click it, it's going to highlight. Can you see the checkbox? Nurse Kelvin, you have your own, you should be able to see it. But Monisola, you should be able to see the checkbox, that thing that looks like a square beside it. Can you see this thing that looks like a square on the side here that has been checked now?
Yes.
Yes, ma'am.
So I'm done watching this video now. I check it. If I'm done watching this one too, I check it. If I'm done watching this too, I check it. You understand? So I must have checked all before this module will open. This will not open until I've checked all and I've done my worksheet. The worksheet is supposed to be mailed. You will see the Gmail that you're supposed to send it to. Are you with me?
Yes, ma'am.
Yes, ma'am.
Okay. So the note I was saying you have to read, this is the note, 14 pages. Next, you click next, it goes. Next, you go, it goes. Next, you go, it goes. Next, it goes, and so on and so forth. I think that one is straightforward, is self-explanatory.
Yes, ma'am.
So that by the time you are done, for instance, if I was the one doing the course now, I've watched this video now, I click it, and then it highlights it for me. I'm waiting for it to highlight. I've watched this, I click it, it highlights it for me. I've watched this, I click it, it highlights it for me. Then I watch this, and it highlights it for me. So what you see what it's saying now, it says new section unlocked. You've completed all lectures in this section. Your next set of lecture is now available. So are you ready to continue? If yes, continue learning. If not, maybe later. But since we are doing a demo, let's continue. So we are finished module 1 now. You can see module 2 is now showing up. Please, are you tracking with me?
Yes, ma'am.
Okay, then you
Yes,
can
ma'am.
see all of the introductory things, important things like that. Then the week 2 note is also there. It is opening for us. You will also go through the week 2 notes. Week 2 notes, 19 pages, flip through, go through it, make necessary whatever it is that needs to be taken care of take care of it, and when you are done, it's done, closed now. So just the same way you would highlight everything you do, you finish, and then when you get to worksheet, you do and mail. Please, do you understand so far? Okay.
Yes,
so now if we come back where we are now in the course, remember when we started, it said 0%. Now, currently, I'm at 9%. So I can track how much I have done. And I'm currently in unit 2 of 2.
Okay.
Okay, so I think that covers the demo part. So the other thing now is, like I said, meeting is once a week. It's flexible anyway, since it's only 3 people. It's not like we have a crowd. So it could be Saturdays, could be Sundays, but we'll say tentatively Sundays. And then the assessment is every the last Sunday or the last weekend, as the case may be. The assessment is on site, is not online, and is written. So there is printed question that you will sit and you answer questions on the modules that has been covered. Then the case scenarios that will be posted within the week, please engage with it. It will just facilitate the learning. For adult education, it's not that we're doing it for the sake of obtaining a certification, it's that we have a head full of applicable knowledge. So I think that covers the important thing that I would want to cover here. So maybe if we have questions, we can take it now. Do we have questions?
Ma, it's just about how to assess the course, ma.
It's still the same thing I'm saying. Nurse Kelvin.
Yes, ma.
Can you put her through when we are done?
Yes, ma. I'll do that, ma.
Okay. All right, ma.
So what I can do is, if you can share your, do you know how to share your phone, your screen on phone?
Okay. You mean me, ma?
Is it ma?
Yes.
Okay.
No, I'm talking to Nurse Kelvin. Or maybe on Monday, you can come with your phone. I'll help you assess it if it's a challenge to navigate it alone at home.
All right.
Is that all right? I'm talking to Mrs. Monisola. Would you come with your phone on Monday? If Nurse Kelvin will try and see if he can explain to you, but if it's still a challenge, it looks like we need to see face to face, so I can tell you, press this, press this, press this. Is that all right? Hello? Hello? Can you hear me, please? All right. Nurse Kelvin, I think we'll call it a day if you don't have any question. Okay, Mrs. Monisola's internet is highly unstable. So I think we'll call it a day. Kindly help me see if she would be able to figure it out from your own hand. If she's not able to, on Monday, she can come with the phone to the office. I would help her sign in.
All right, ma. Sorry, before you go, you said the
Yes,
class will be once in a week.
Yes, it's once a week.
Okay, so then in terms of module, I don't know if we have like a specific time that we like a kind of time we need to cover like a module.
You know, because every theoretical thing that needs to be covered about the module, they have all been taken care of online completely. The meeting is just to reinforce. I am the one in charge of the slide, the teaching slide. You already know what the module entails. I am the one producing the teaching slide. You are the one engaging. Then maybe during the week she has watched some videos and she needs clarification. That's an opportunity to now clarify. Then the alternate that you're around, that's the time to give hands-on to procedures that she's not been able to pick during the week. Admin will get the logbook across to her on Monday. And since she's resuming as a staff, she will be able to double both and be able to put her eye on procedures that are going on.
All right, ma'am. All right.
All right.
Thank you, ma'am.
Thank you very much. So have a wonderful day.
All right, ma'am. You too, ma'am.
Okay.